This is John Dougherty, Free PT Now. Today I'm going to be talking about tennis elbow and golfer's elbow. So two very common conditions, and the treatment is very similar. So just to quickly go over the anatomy. So golfer's elbow is typically when you're going to have medial elbow pain on the inside of your elbow here. And they call it golfer's elbow because basically when you're doing a golf swing, typically that backhand, you're going to get a lot of torque in through your elbow here. So when you're coming through and you're swinging on your follow through, you get a lot of torque through that elbow, causes strain through the tendons there, and that's what causes pain. Tennis elbow, the opposite is basically, it's named that way for when you're doing a backhand in tennis, and when your wrist is coming this way, basically you're going to put a lot of strain through the extensor tendons on your forearm, and that's what leads to the irritation and the pain that you're having on the outside of the elbow. So typically, these injuries are tendonitis or tendinosis. The treatment is similar most of the time as far as exercise is concerned. The exercise is going to be the same for both of them. First, for golfer's elbow, all of the muscles of your forearm flexors here on this side of your forearm, are the muscles that are going to help to bend your fingers this way and also bend your wrist up towards you. All of these muscles come and they insert at a common flexor tendon right here at the medial epicondyle of your elbow. So basically at this pointy bone here on your elbow. You have one common tendon that leads to a number of different muscles that go down into your forearm and into your hand. So when you have overuse, you start to get strain, irritation on that tendon, causes pain. So the primary exercise we want to do for this is going to be an eccentric wrist curl. So a typical wrist curl is going to be when you just have a weight, a dumbbell, you're going to curl up and then back down. An eccentric wrist curl is where we want to focus only on the down portion, the eccentric portion. When you're going up, this is called the concentric. When you're going down, that's the eccentric. So what you want to do to isolate the eccentric is going to take your left hand, lift it up, bring it up to that fully flexed position, and then slowly go down, a real slow 5 count on the way down. So 3, 4, 5. And then on the way back up, use your left hand. The right hand is passive during this. The left hand's doing all the work. And then slowly back down. 1, 2, all the way down to 5, back down. So 3 sets of 10, very slow on that eccentric portion, at least 5 seconds. And on the concentric, make sure you're not actively flexing the wrist, that the opposite hand is doing all the work. Likewise, for your extensors, which is going to be when you're caused by tennis elbow, what we call tennis elbow, caused by overuse of the extensor side of the forearm, the treatment is going to be the same. And just like on the flexor side, it's the exact same situation. The muscles that go down into your fingers to extend your fingers up and extend your wrist up this way all come through the forearm and insert at a common extensor tendon here. That's why it's irritated in the same way. The mechanism of injury is similar, typically overuse, and the treatment is going to be similar as well. So just like we did on the other side, now we're going to flip it over and do it the other way. So again, you're not going to do the concentric portion. So you're going to use your opposite hand to lift the wrist up and then slowly down, at least a 5 count. Nice and slow on the way down. Take your hand, lift it back up, real slow 5 count on the way down. When performing these exercises, you should have no increase in pain. So if you're already in pain, say if you have a constant pain level of 5 or 6, then if your pain stays at 5 or 6, or a slight, very slight increase, maybe of 1 point is okay. If you're having increased pain to 9 out of 10, 8 out of 10, then you're either doing the exercise incorrectly or this isn't the correct exercise for you. So I want you to try out these exercises. If you're having medial elbow pain, it's going to be the eccentric wrist curl. If you're having lateral elbow pain, it's going to be the eccentric wrist extension going down this way. 3 sets of 10 of each, and we'll see how that does for you.